Hi, everyone. I'm Shawn Domanic from Avathon Capital. I'm so glad all of you chose to be here today for what I personally believe is one of the most important topics of the week. It's a really critical issue to discuss, a really complicated issue, and we've brought together some of the brightest leaders who are trying to solve the problem in the space. So we have on the panel today Alex from Daybreak Health, Michael from Hazel Health, Maria from Clayful, and Danielle with BeMe Health. So I thought we could quickly just jump right in, kind of get to some of the issues. Jose obviously articulated a lot of different things that kids are struggling with today. Anxiety, depression, violence. I guess I'd raise to the group first, are there any of those issues that you view as a priority to really dig into and solve, both from the lens of remedying the issues that are currently developing, but also preventing new issues as they pop up? Since Alex is sitting next to me, I'll kick it off with you.
Thanks, Shawn, and I'll just echo, Jose, thank you so much for sharing your story. I just want to start by putting a little bit of a point on something that I think was an undercurrent throughout what Jose was saying, which is, and it's important that we kind of all align on this, which is that schools are really the most important provider of mental health and social emotional support for our young people. And I think that's something that has become a lot more clear over the last couple of years. But if you look at it, 3 in 4 youth are receiving mental health support primarily from a school. And so I think, when you ask the question, what is the most pressing problem here? I think that we need to better support our districts who are under-resourced, honestly, understaffed, with easy to turn on and thoughtful solutions that can serve a wide range of what you're saying here, Jose, in terms of what students are struggling with. I think the funding is there now, and there's a realization that schools can do this and should do this, but district leaders, I think, need more support and more staffing and more resources.
Michael, I'll toss it to you. Any thoughts on that?
Sure. Props to Mom. You're supporting him. Well, actually, how many of us are parents, I guess, in the audience? And then how many are school admin, superintendent, staff, and then work in the field and somehow mental, okay. I think I would approach this question in terms of depression, anxiety, bullying are the outcomes that we see that cause us to take action. And it's really great that now we actually have increased support to do something. I always think about this quote, if you've read this book, There, by Tommy Orange. It's about fictionalized real-life stories of Native American families growing up in urban Oakland. He talks about a conference, a youth conference, where we talk about serving our kids, but what we're doing is putting bars on windows versus putting out the fire on the floor, and our schools are facing that, for instance, our families are facing that. So as we invest in solutions to address depression, anxiety, those are clinical symptoms that happen very late. What are we doing to put the fire out? And that's what Jose was speaking to in terms of that's what meditation is, that's what building hope. So I would say that we can focus on the clinical symptoms. That is our means to start addressing these problems, but it's really a holistic approach that we have to take.
Yeah, that's great. One of the topics I wanted to get into was the use of technology in trying to solve some of these problems. There are skeptics out there that say, throwing technology at solutions is never the right way to go. Technology doesn't solve every issue that is currently permeating, our school system. So how do you all think about the balance between using technology versus direct services and trying to solve the problem? Danielle, I'll start with you down there at the end.
Sure, thanks. So we think a lot about how to use technology to democratize access to some of the skills that Michael talked about and some of the challenges that Jose shared with us. So unfortunately, whether we like it or not, young people and teens are using technology to access most of their mental health support today. Even if it does exist and is available in school settings or outside, although we know that there's a huge barrier to access to things like therapists and psychiatry treatment, teens are more often getting their mental health support on TikTok. And this is not enough. So what is really needed is technology solutions that will deliver the right kind of science-backed support, but also that teens will connect with. You know, I keep saying teens because I'm super focused on teens in the work that I do and in my research. But I think even the middle school years and younger teens are more likely to seek out support when they're feeling sad, when they're feeling anxious, on platforms like social media, YouTube, and that's certainly not going to solve the problem. So whereas there's no doubt that an in-person connection can be really important for many young people, especially those who have clinical diagnoses of depression, anxiety, PTSD, and other kinds of mental health concerns, technology has to be part of the solution, but the right technology.
Yeah, Maria, anything to follow up with that?
Yeah, I mean, you mentioned connection a couple times there, and I think that at the core of what we lost during COVID was really human connection. And so much of us, I mean, even if we were at home with our families, we missed our friends, and we missed having this around us, right? And that fuels us, because at the core, we are social beings. I mean, you think about social emotional learning, it's literally in the word social, right? So I think technology can play a huge role in decreasing barriers to access. And, you know, like teletherapy does a great job at making it easier for families to be able to provide therapy without having to drive there, right? And without having to manage schedules. But at the core, we still need humans behind it, right? So an app is just not going to be enough. TikTok's algorithm is not smart enough to know, oh, you actually should watch this versus this, right? And it often doesn't lead you to very good places. So I think continuing to foster connection and finding ways that our educators and our kids can connect with each other and with people who care about them, that's where we can start to build foster a culture of connectionness and actually thrive versus always trying to mitigate the damage, which is kind of what we have to do right now.
Yeah, one thing you both brought up that I want to dig a little deeper into, you both brought up TikTok, obviously a relevant app that kids are using these days. You all run and lead companies that have a unique, each of you have a unique business model, but both leverage technology and services to try to generate value. Like, how do you make the services piece of that more engaging? Because kids today, even folks in my generation, technology is engaging, that's why people are drawn to it. How do you ensure that services that are very critical to solving the issues are engaging and also impactful?
Yeah, I can take a first pass at that. From our end, we believe that the service needs to come from a place of caring. And the moment that a kid actually realizes, oh, there's a person on the other side who cares about me, and they're listening to what I'm saying, they're reacting to that, that goes such a long way, right? Like, why do you think likes are such an engagement and sort of triggering factor for all of us, right? Because you feel, oh, there's that social need to want to feel accepted and loved and cared for. So that's why I feel that human connection is so important, and showing that you care goes a really long way. So we train our coaches that way, and just try to overemphasize like empathizing and connection at the core.
Yeah, I'll build on that. I totally agree with that emphasis on the connection. And, you know, the way that we think about it is, you know, every kid needs something slightly different. And we talk a lot about one size fits one in terms of both the intervention level that a student is going to need or a young person is going to need, but also in terms of when you hone in on a specific intervention. I'll just take therapy as an example. How can you actually make that therapy engaging? Our perspective is by finding the right match for the person on the other end. So whether it's personality factors, whether it's just the clinical need that's presenting, right? If it's bullying, matching the kid with somebody who has expertise in that. If it's anxiety, matching them there. But then also just the style, right? I think some kids prefer to get a little bit more structure, maybe some homework in terms of how they engage in therapy. Other kids are just looking for a friend to talk to. And being really thoughtful about that one size fits one, I think, is very, very important for making the services aspect a little bit more engaging.
I'll quickly add, if you attended U.S. Surgeon General Dr. Vivek Murthy's talk yesterday, he had the best answer for how technology plays I've ever heard, which is technology should basically help us lead healthier, better lives. So I spend a lot of time with young people still, which I really love. Some of them, their only outlet for understanding what depression is TikTok. So taking that away is not the answer for some because they're looking for answers about like, is what I have an actual problem? There's a lot of students struggling with understanding, am I making this up? There's also people looking out for, my friends are struggling and I don't know how to help them, right? So if technology can help them further that conversation, gain the training, and I really love what Maria said in terms of, it's really about, can we help each other heal? And engagement in technology is likes, clicks, attention. Engagement in mental health is very different. It's not just like, am I in front of you or paying attention to me? Have we connected? Do you feel seen and heard? And I think that's how we should think about technology in this space, how it enables that. And I think everybody basically is saying the same thing there.
I'm happy to add two quick other things from my perspective. First, as a researcher, I started my career in academic medicine, where I was designing and evaluating the efficacy of interventions delivered through social media. And this was an entirely new space at the time. I won't tell you what year, but I will say we started with Facebook and teenagers, so you get the sense it was a while back. And we had this hunch. We started with helping young people quit smoking and have then moved on to quitting vaping, which, as Jose mentioned, is still a real issue among teens. We had a hunch that we could design something that might seem innovative in a social media context, like classic social media style content, but that there would need to be a live connection in order to really help teens both feel connected to the idea of changing a behavior that's really hard to change, and also that would be needed to actually make the intervention effective. And that is indeed what we found in our research studies. Those teens who engaged with a counselor were more likely to quit smoking, were more likely to quit vaping. So we know that to get the right impact, there needs to be that live supportive connection. And to answer your question directly, Shawn, around how do we make that supportive piece more engaging, one thing we're thinking about a lot is designing directly with teens, asking them what and how do you want to connect with people? What does it look like to you to have a connection that is meaningful? How do you want to interact with other people? And only when we really listen to teens, the true owners of their mental health and well-being, will it ever be successful.
Yeah, that's a great point. Bringing them into the discussion is critical. One other thing, to switch gears a little bit, one thing I've observed in some of the things that Jose kind of outlined is when these issues and events tend to arise, there are folks that directly or immediately tend to medicalize the situation and push it into a healthcare context. With that, how do you guys think about the balance of clinical supports and non-clinical supports for mental health within this environment? Because both are, in my view, equally important. We'll start with you, Alex.
Sure, I think it goes back to the one-size-fits-one concept, right? And I think districts actually already have a very good framework for how they think about this. Districts talk a lot about this idea of multi-tier interventions or multi-tier programs. You've got tier 1, tier 2, tier 3, and that's kind of, each tier you go higher is a little bit higher in the acuity of the mental health need. And I think when you're working with somebody, with a student who is maybe dealing with a slightly lower acuity thing, maybe they're starting to struggle a little bit with peer relationships, it's not quite severe bullying yet, lighter weight skills development, social emotional learning types interventions can be better, but the further you go up the acuity spectrum, the more clinical in nature it needs to be. We just know that from an evidence-based perspective. So again, I don't think there's a one-size-fits-all answer here. I do think it's where is the student in their need and their journey, and what's the right intervention for them at this point in time.
Okay, I'm probably going to get in trouble for saying this, but so I'm a clinician by training. I've focused on adolescent health. I'm also a former middle school teacher. I taught in Chicago. And I think I have to contextualize this. And I work in a company that delivers health care to school districts for all children at no cost. What we need from the medical system are their dollars. What we don't need is their medical model in certain ways, but we have to build around it. And what I mean by that is, if you haven't read, last month, the American Psychology Association came out with a public apology saying, we have contributed to the pathology of black and brown children in this country. So this is a deliberate thing that we have done in the medical institution, right? So in terms of medicalization, right now, health plans will only reimburse you for services rendered, for instance, of diagnosed depression, diagnosed anxiety, right? But we also know that that tracks social basically status, barriers, racism, that's all tied to that. So what we're recognizing now is that we have to play this game of how do we take advantage of the systems that exist to get care for those that need care, but then how do we really challenge ourselves and push ourselves to redesign the system and say, just because I don't have a depression diagnosis, does that mean you're going to gatekeep me from seeking care? One of the most powerful things I've heard a young person say to me, a high school student from Nevada, she was saying, why does somebody else have to decide if I can seek mental health care? But we live in a country where that is the case. Now, we haven't solved it, but it's because we've medicalized everything. So the answer here is not to throw it out the window. It's to do that, but then expand, right, into the other non-medical portions and recognize that that's equally important. So I hope I don't get in trouble for saying that, but that's my personal thought.
Yeah, what I think is really interesting here is that there's so much that we can do before a kid gets to a crisis moment. And unfortunately, like Jose mentioned, there's still a lot of stigma against mental health, getting mental health support. And as I talk to parents and families, it's really hard to recognize that your kid needs help because people feel that it's a reflection on their own parenting skills, that it's something they did wrong, that it's a sign of weakness. And we know that it's not, but it's still, society hasn't quite caught up with that, right? So we keep on telling ourselves that, but do we really recognize it? Like, do we really accept it? Are we actually going to openly talk about, like, hey, I'm having a really bad day today? It's still not normalized, right? And that means that when I talk to therapists working with kids, they say, by the time a kid gets to me, there is so much I have to undo that anything you can do on the preventative side can have 10x the impact. Because it takes so much for a family or a teacher or a counselor to refer to a clinical specialist outside of the school system, that at that point, it's not that it's too late, but there's a lot more to do, right? So how can we build better interventions early on? We have SEL curriculum, that's great. What comes after that, right? Like what's in between SEL curriculum and weekly meetings with the counselor? We have a gap there. Teachers have actually filled that gap for a long time, but they can't do that right now, right? Teachers are struggling. And how do we help districts sort of fill that gap outside of themselves, outside of their staff, so that it's not an added burden on them? That's what I think a lot about.
I think a lot about that too. I really appreciate everything you said. And as one of those adolescent trained clinicians that you're talking about, I too, like Michael, came out of that with the idea that the behavioral health service system is deeply antiquated and in need of pretty major innovation and in order to really serve what all young people need today. Jose talked about his friends, your peer group, suffering and having a lot of challenges. And I almost don't meet a teenager today who doesn't tell me that they have been deeply struggling. Will those teenagers necessarily be the ones that are referred to a clinician for treatment? Probably not. There's no doubt that there is absolutely a need for licensed clinicians to deliver their care in the way that is evidence-based and will help teens who meet certain criteria. But I wholeheartedly agree with what's been said before, that we can do a lot more before young people get to those clinicians. And we really need to do more innovation in this space to democratize access. So it's not just those who can afford it, those who have access to certain kinds of insurance, or those who meet certain levels of criteria that get those services.
Yeah, I completely agree. The preventative and not the remedial is something that really needs to be focused on. I guess playing off the healthcare topic and the medicalization topic, one of the things that's been on my mind, and I know we've talked about leading into this, is one of the things that is also a comprehensive topic across K-12 education, which is just equity. And the healthcare system today is handling the problem in a certain way, which is limiting the ability for everyone to have access to a lot of these critical supports, given constraints around affordability. Maria, I know you're very passionate about this particular topic. I'd toss it to you. When you're thinking about the education channel as a way to really drive equity, access, inclusion into a lot of the supports that are needed for the students. How do you think about constructing that framework and how it can be, really a driving catalyst in trying to solve a lot of these problems?
Yeah, I mean, the pandemic affected all of us in some way, shape, or form, but it didn't affect every kid the same, right? Like disproportionately, people of color were affected differently, right? Like you see, the CDC just published a report last week that where 25% of teens felt hunger throughout the pandemic, right? Because as Jose said, it's the one place they can get warm meals. So there's so much that we can do as a society to better serve people without disposable income to be able to pay $200, $150 for one therapy session. Because if you're trying to go through the insurance route, you need to have a diagnosis, right? You need to meet certain standards of care in order to be able to get that. And that means that there's a lot of kids that get left behind that don't get that access. And there's a lot of families that don't know how to navigate. It's a complex system. I don't know how to navigate the system. And we can't have these families need to rely on these very, very complex systems and economics to be able to get care for their kids. So that's why we've chosen to partner with schools, because it's a place where we can reach every kid. Every kid, we believe every kid should have access to this. It's not when they raise their hand, but it's actually, hey, everyone has access to this. When you need it, use it. If you need it, use it. But you don't need to go through all this paperwork and all this friction to get it. We just sign you up, and that way you can get it when you need it. And even just reducing that friction makes such a big difference, because right away they know, oh, this is something we can have access to. And it, again, goes a really long way to reaching those kids specifically who tend to suffer in silence. We find out about the kids who are acting out in class and who are having lower grades, their attendance rates are low. We can reach those kids. But what about the kids who are just sitting in the back and not talking? We don't really reach them. But if we give them a channel to be able to ask for help, that can change everything.
I kind of have a call to action to, if you're a VC person here, an investor, look at the business model of the companies that you want to take care of mental health for kids. If you're a superintendent, ask for help in figuring out how to make the money work, because there's a fallacy, I think. There is money there, and it's what we're willing to invest in and create models to support. Equity, so my biggest fear in this moment in time is, so a lot of us are friends on this panel. I'm so excited to be here because 3 years ago we would not be on this panel. There wasn't enough funding or money or care about this issue. And we have this moment to really, you have places, states where 2 to 5% of students receiving public services are actually getting mental health care, right? There's an access gap, but there's an equity gap too. If we don't intentionally support and fund and create the services that actually close that, the equity gap is only gonna grow 10 years from now, okay? That's gonna get bigger. And we don't solve this just by putting more therapists out there. In fact, we're not utilizing our therapists in ways where you can put in, like, I'm gonna go back to the comment about medicalization of clinical care. The truth is, I'm an immigrant. A lot of immigrant families don't want to talk to doctors because of the experiences they've had. So you can put as many therapists in front of me, but I'm not going to go see them. How do you take them on that journey where they understand that this could benefit, right? And also do the training on the other end to make it relevant. So that's one thing. I do think we should also celebrate things that have happened. So Medicaid policy, for instance. We've gotten to this point where not only special education students can get clinical care and the schools can bill for that, free care expansion in many markets has allowed general ed populations to reach services. The problem is that school districts are not healthcare centers, so they're not set up to bill and basically support those services. Hiring is a different problem. So I think the intentions of what we're trying to do to solve equity are good. Implementation-wise, we have a lot that we can support better. Now, especially in California, there's a whole bunch of money and attention to sort of say, how do we solve the equity gap? The health plans are interested and the schools are interested. Neither of them really want to work together because they're two big bureaucracies that don't want to spend a lot of time. So now it's up to us to say, if we really want to tackle this equity thing, let's actually figure out how to do this. So just another claim, the companies here, regardless of our companies, really scrutinize how they're paying for this and how this is going to get service to your students, every student in your district. And if they don't say they can, we got to stop that conversation.
Danielle, Alex, anything to add?
I 100% agree with the financial comment and the economic barriers to access. So I won't add anything there. I will just say, as we're doing this, we also need to be super thoughtful about other types of barriers, whether it's education, stigma, cultural barriers to getting mental health support. And a lot of those barriers can't be solved by just making the money available or making the care available. It has to go deeper into working with families and changing the conversation around mental health across cultures. So I'll just add that, and I think it's similar to what Maria said as well. Super important that everyone feels like they deserve mental health support and they can benefit from mental health support, even when it becomes available to them financially.
Great. One other topic I wanted to hit. We have about 7 minutes left. One of the things we've seen on the investment side is that there's clearly a debate around who owns mental health. Does the ownership and the responsibility lie within families? There's a camp that would say it should be family-driven and that schools should stick to the academic component of student success. There's also a camp that would say mental health is a foundational element of how children and students succeed. How do you all think about how we can best collaborate, all of the various constituents across the education sector, including yourselves, to really drive together towards accomplishing the goals and solving some of the problems that Jose outlined?
Can I jump in?
Do it.
First of all, no one owns mental health except young people themselves. And that really is the frame that we all have to come at addressing this problem with. The other is that there is never going to be an owner in the spaces that we all are in. This problem is so much bigger than any one of our companies is ever going to solve alone. And that's because there, like I said before, and as we've all identified, there is so much innovation needed in the business model space, in the service delivery space, in the way we think about who should and who traditionally has had access to mental health supports. And we all are doing our own flavor of that innovation. It's all going to be needed. There are going to be multiple solutions that will end up working. And I think, unfortunately, it's not going to ever be that simple, but the good news is that there's so much opportunity for innovation that we are still so needed. And finally, the four of us are up here. I'd also say that a panel like this would not necessarily have had Jose up first, and it was so special and wonderful to be able to hear from you because you're the real person who owns what we're all here to talk about today. So thank you. And yeah, just really proud to do this with you all.
Yeah, I will add that we have to accept that kids exist in a system, right? That system is comprised of schools, it's comprised of families, it's comprised of their peers, social media, right? There's a lot of moving pieces. And in a perfect world, all of those moving pieces are saying, okay, there's a big problem here. How can I make my piece of the puzzle better, right? What are the things that I can do to make this problem go away? So with schools are thinking about this so much, and it wasn't happening 6 months ago, right? The conversation has picked up so much over the past 6 months, which is incredible to see, and pandemic silver lining there, because we know the mental health issues were there, but the pandemic has finally opened our eyes. How can social media take a look and say, oh, when I have a 13-year-old looking at self-harm videos, maybe I should readjust the algorithm and take them to see like puppies instead. That would be great. And then why don't families realize, hey, there are all these other people in the system, how can they support mental health instead of having that be my only job, right? This fight against, oh no, schools are only education. You can't teach a depressed kid algebra. I'm sorry, you can't, right? Like that's just, it's not going to work. So how can we all look at the system and realize if we all work together, we can actually make a dent in this problem. But if we keep on fighting with each other, we're just not gonna get anywhere. So all of us own it.
Yeah. I'm going to push us to final thoughts because we only have a couple minutes left. Let's all leverage wizard skills, fast forward into time, 10 years from now. We'll go around the horn, each get a minute. What does the world look like in terms of the ecosystem of mental health within education, and juxtapose that against what your ideal view of what it actually should look like? Go down the line. Alex, you can kick off.
Absolutely. Well, I think we're at a really, really exciting moment in time where if you look at history and try to look for like historical examples, the last time that we had this big of a movement surrounding funding change and movement at the federal level was really when PE, physical education, got introduced in the 60s and 70s, and before that, free lunch in the 50s. And not saying that, PE got implemented in the greatest way in the world. I don't know if all you loved your PE class, but that opportunity is in front of us. Today, 95% of schools in the US provide physical education as a mandatory part of the curriculum for kids. And I think we have that opportunity in front of us where every kid can have access to some level of social, emotional, mental health support, just as a fact, as part of going to school. And there are going to be different levels of mental health support needed for different kids, and I do think we should be very thoughtful about how to personalize it to that one size fits one, but I do think that that's what the world will look like in 10 years, and we have the opportunity in front of us to really make that implementation the best it can be.
I'm gonna be hopeful in 10 years. Just like how telehealth has become table stakes in terms of the ability to do secure visits, I hope that in 10 years it's table stakes that we're able to deliver clinical care to students through schools and have everybody have access to some sort of therapeutic intervention if needed. That should be baseline. Let's not pat ourselves on the back too much for that. Let's get there and get that done. I think that the turning point we haven't yet hit is the science of flourishing. So if you don't know, like Adam Grant wrote an article about this based on another researcher's work, but we need to be able to fund those flourishing programs because that's more predictive of college success and depression, but we're not there yet. We still got to prove to people that we can do this clinical model, and I hope in 10 years where we are is we're equally supporting those well-being initiatives.
Yeah, I think for me, if I could just wave a wand, we would destigmatize mental health and realize that mental health is health. It is not a sign of weakness. It is not that anything's wrong. It is just part of you, and we can talk about it openly. That would be my wish.
I love that. And I agree with what everyone else has said. I, in 10 years, would love to see that all young people have access to identity-affirming, resilience-supporting tools that let them navigate the here and now and go into young adulthood feeling like they can be their true selves. And I'll add that I would love to know that these interventions work. And I think we can get there in 10 years.
I love it. Thanks, everybody. Jose, thank you.
Thank you.
Thank you, Jose.